My name is Ian Cross. I'm on the General Dental Council list of specialists in endodontics and prosthodontics. Now what that means is that apart from having my general dental degree, I've also got a Masters in Restorative Dentistry at Leeds Dental Institute. Endodontics is often referred to as root canal work, and root canal work is that specialist area of dentistry which is working on the area of the tooth where the nerves and blood vessels of the tooth are. To a certain extent, the root canal work should just be considered a very, very routine dental procedure. From our point of view, the patient comes in, it's just like doing an extended dental filling almost, and that's what the patient should consider as well. Root canal work normally will take 2 visits. We do try to work over 2 visits. It just gives us a better chance to make sure we've found all the debris within the root canal system, cleaned all the debris out, and make sure the tooth is going to settle nice in response to treatment before we progress further. Patients are very often referred to us by their own dentist. Sometimes patients realise they've got a dental problem and they might talk to a friend's been here before, and so they refer themselves to us. A lot of the time patients are coming through because they've had a long-standing dental problem, and with all due respect to the dentist, sometimes root canal work and endodontic treatment is not very well understood. It can present as some quite bizarre symptoms. So a lot of the work that we're doing here is diagnostic in nature and working out which tooth, if it is a tooth, is causing the acute pain. Root canal work should not be painful. As I've mentioned before, there are lots of apocryphal stories about root canal work being painful. The key to root canal work is you've got to get the tooth frozen up. I would be the first to say that a badly inflamed pulp can be difficult to anaesthetise. You just have to spend the time on it. And again, here at Harewood, we've got the time to sit with patients and to make sure the tooth is frozen up before we start the treatment. Good quality anaesthesia, it's the bedrock of what root canal work ought to be. Patients are naturally nervous about root canal work. Most patients here are nervous or apprehensive about the procedures to some extent. And a lot of the time it's just sitting down with the patient and explaining what the procedure is, that realistically, if a patient can go through normal dental treatment, then there's no problem in carrying out root canal work. I think the benefits of having treatment at Harewood is that we have the time to spend with patients. To us, a patient coming in for root canal work is the same as coming in for any other piece of dental treatment. It's very straightforward. I think it's important that within the practice, every practitioner in the practice has the same approach, that we take a holistic approach to the patient. What we're looking at is whether or not the piece of treatment, whether it's implant work, whether it's root canal work, is it going to be of benefit to the patient? How is it going to benefit the patient? Should they really be contemplating this work, or is another treatment plan more appropriate for them?